Record.
Sure.
I'll do a clap, and then I'll introduce you, and we'll get it started. All right, ready? 3, 2, 1. What's going on, guys? Patrick and Cam here for Men's Health Unscripted. We have Dr. Houman with us, and we're going to talk a little bit about testosterone replacement therapy today. So thanks for coming on, Doctor.
Absolutely.
It's a real pleasure to have you on. I think that there's a lot of misconceptions about TRT in the world just because of the steroid era in baseball and the way kind of like it's abused with bodybuilding and other athletics. And I think it would be good to give some of our viewers who are maybe interested in TRT or are kind of caught up in the news media riffraff of it, and really maybe clear some things up and get some of your professional experience. How does that sound?
Absolutely. Happy to.
Excellent. So let's just kick it off. What age are guys typically losing testosterone and those levels kind of going down? Can you describe some of the numbers that we might see as a professional in patient labs?
Yeah. So, typically, obviously it varies. Everyone's biology is slightly different, but for the most part, the average guy at the age of 30, his testosterone goes down approximately 1% each year. Now, to what extent is that going to affect them? Again, it's very person dependent, patient dependent. So some people, it's going to impact them when they're in their late 30s. Other times that slow decline they won't realize it until their 50s or 60s. But generally speaking, around the age of 30, testosterone levels start to decline.
Okay. And then so if a patient came into your office, kind of interested in this, I know, states kind of have probably different laws about this stuff, but what would kind of be the stepwise process that a new patient or someone interested in this might have to go through?
So when it comes to testosterone, right, there's two ways in which you diagnose low testosterone. Hypogonadism is what we call it. Two ways. The first way being the objective number, the blood test, which is, it's a simple blood test. So you go in, your primary care doctor, your urologist, your men's health specialist like myself, whatever it is, draw the blood test, and then that's the objective number. And then subjectively, you have to assess your symptoms. So some guys, when it comes to treating testosterone, some guys objectively their number is on the low end of normal, but symptomatically they're subjective. When they would describe their subjective feelings, like they have really low T, or they have a lot of the symptoms of low T. So really, it's those two things: symptoms as well as blood tests to see what your testosterone levels are at.
Oh, it's good that you bring out some of the symptoms. What are some of the symptoms that these patients may be having, or at least where they present?
Yeah. So it's low T symptoms. A lot of it's fatigue, poor sleep, just not their mood's off. They get easily irritated. Low libido. That sex drive is gone. They have erectile dysfunction. They're losing body hair. They feel depressed. And then like a lot of them are complaining about, they're not exercising the way they used to. They used to go to the gym. They used to be, able to stay there for 90 minutes, 2 hours exercising. Now it's half that. So, could you have all of those symptoms? Yes. Could you have a few of those? Absolutely. So it all, again, it all varies. The way my body responds to testosterone is different than yours. So there's no one tried true symptom that says, hey, listen, this is low T. It's the constellation. It's a variety of symptoms.
Right. We, on our podcast a little bit, we like to clear up that a lot of people think that they go to their doctor, men's health specialist, someone, and get, something like a sildenafil or Viagra, Blue Chew, whatever you want to call it. And that actually, I think in the media or at least advertising, you might have a little bit of misconception that testosterone is where you really pull your libido from, not the PDE5 inhibitor as we would in pharmacy, or the sildenafil really. But that's just going to enhance blood flow to give erections, not necessarily bring about desire, correct?
Precisely. Yep.
Okay. And so now this patient's come in and you've kind of assessed them. What would be some benefits that you would describe to them about testosterone replacement therapy?
So, in discussing the symptoms that they're experiencing, if in fact a blood test showed that they have low testosterone, they're describing the symptoms or whatever symptom it is that brought them in. What we could discuss is at that point, we could say, hey, listen, whatever symptom that you're having, by boosting your testosterone levels and not boosting them to the super high levels, just putting them at where their baseline or what we call eugonadal, right at that normal range is, that symptom for the most likely will be addressed. So if they're coming with low libido, by getting them up, if they're coming with low energy levels, poor mood, again, we're able to just getting them to that level will allow them to, or at least decrease the symptoms associated, or the decrease the complaint they're coming in with.
It's very
All right.
interesting.
That makes sense. So with a lot of patients, so some of the benefits, though, most people are be concerned about like, what kind of risks does it have, and what kind of side effects might they experience on some of this therapy?
Yeah, so because low T is so common, there's so many different ways in which you can administer it. The different ways have different I don't want to say side effects, but different ways in which you have to think about it. So there's a gel, there's like a daily gel that you could apply. That one, there's a risk of transference. So if 2 hours after you apply it, let's say you have a grandchildren at home or kids at home, if you ever put the child on your shoulder, there's a chance, again, 2 hours after application, there's a chance that you transfer it to that other person. There's weekly injections. Weekly injections are probably the most common, where guys inject directly in the muscle. For the most part, that's very well tolerated. The one thing that I do say is every once in a while you get erythrocytosis. Your red blood cell count could go up as a result of the intramuscular injection of T. But again, as long as you're checking your blood counts every few months, worst case, you could just do phlebotomy, or you could just go donate blood, and that should reduce your red blood cell count, allowing you to continue your regimen. And then there's testosterone pellets that we put under the skin. And now there's other newer ones out there. There's the oral ones, some oral testosterone, which is a little less common. And then there's an injection that goes in the muscle that lasts about 3 months. So it all depends on, there's so many different varieties and different ways in which you could take testosterone depending on your lifestyle.
Well, thinking like holistically for the body entirely, you see a lot of it in movies, media, things like that, where it's more of a joke kind of thing, where there's like testicular shrinkage. Is that like a possible effect, or like other overall body effects that could occur just from the extra or the addition of testosterone?
Yeah, I mean, so the testicular shrinkage is real, right? Because what you do is, this is the thing. I mean, if I could stress one point here, and I see this, I do men's health, so I do a lot of male fertility. I don't just do testosterone. I deal with a lot of sexual health, and then fertility. Fertility is really what I deal with, a lot of male fertility. If you take testosterone exogenously, if you're taking injections, gels, pellets, whatever it is, your fertility will go down, right? Your ability to produce sperm will go down almost to zero, right? If you're taking that. Now, is it permanent? No, but it's something to be mindful of, because I have a lot of like late 20-year-old guys that come in, they're like, I'm on testosterone, but I have zero sperm. Reason being is because, they're on testosterone replacement therapy. So, to answer your question about, actually repeat the question again?
Some of the overall like body effects that replacing testosterone could have.
Yeah, so the testicular shrinkage is real, definitely. It's just, but the other thing is, guys will notice they're losing weight. I mean, they have more energy, they're going to the gym more, so the lean body mass will improve. That's the main one. It's really it's energy, and as a result of that, they could start to lose weight because of that.
Okay, and then in my experience in the pharmacy, I kind of interned a little bit at a compound pharmacy, so we did a lot of hormone replacement therapy for guys and girls, and I noticed. A lot of times with testosterone, you might have like an anastrozole or something co-prescribed with it. Could you just tell our viewers a little bit about why they might have another prescription on top of their testosterone and what some of those medications do? Yeah,
great question. So as guys, testosterone is our main hormone. However, we do have estrogen in our bodies. Estrogen is an important hormone for men at small levels or small amounts. So it's important in bone. Good bone health. It's important in cholesterol metabolism, amongst other things. It's also there's a correlation between estrogen levels and libido. Now, do we want we want your estrogen levels high? No. And the reason why that could happen is this: when you take testosterone replacement therapy, your testosterone levels go up. Our body converts testosterone to estrogen. Our male body, it's done in our fat cells. So some guys, it's called aromatizing. Sometimes that aromatization happens faster in some guys versus others. So sometimes that boost in testosterone will be converted to estrogen. As a result of that, they get elevated estrogen levels. Some of them will get breast tenderness as a result of that. So we give a medication called anastrozole, which blocks that conversion, that enzyme that I was talking about. It stops the functioning of that enzyme. So your testosterone levels remain high, but your estrogen levels remain stable.
Excellent. I think that was a really comprehensive answer. And I know that actually one of those questions came from one of our viewers. They we got a couple of them mixed in here. So
Yeah.
just want to know, I think it's really interesting topic. We'll keep moving. So how would a patient, hormone replacement therapy is a little more complex than probably taking your everyday ibuprofen. You can kind of start and stop that. Have you ran into any patients or any issues with patients abruptly stopping it or starting these kind of treatments? And if so, are there any potential adverse effects?
You stopping the testosterone?
Yes.
Right. So if somebody, maybe they're on testosterone therapy for a certain period of time, and then they decide that they don't want it or they can't, for the treatments, whatever the case may be, what are some of the adverse effects to abruptly stopping, or is there a taper down kind of method that you might use?
Yeah. So, your body needs testosterone, right? Every male body needs testosterone for not just, sex health, but more for energy levels and just quality of life. We all need it. Now, when you take exogenous testosterone, when you're injecting or gels, whatever it is, what have you, you're essentially stopping your own body's ability to produce testosterone. Now, when you come off of it, if you immediately come off your testosterone replacement therapy, you're going to feel like crap, right? Until your body, your testicles start to produce natural testosterone. So you're going to have a little bit of a hiccup. Now, what do we do in that situation? There's medications that we could use that could basically boost your testicles' ability to produce testosterone. So it makes that dip not as drastic. It lessens that dip. So there's ways in which to do it. Obviously, you have to do it in the care of the doctor, but there's definitely ways in which you could, basically transition from artificial testosterone to naturally produced testosterone.
Do these transition modalities, do they often change like the route of administration? So people using injections, would they like slowly taper and use, patches or the gel for a certain amount of time, or would you have to stick to the modality you started off with?
No. You could switch. You could switch to whatever. I mean, a lot of guys, they're on the injections and then they're like, you know what? I don't like injecting weekly. I'd rather have pellets underneath my skin and deal with it every 3 months. So, yeah, you could transition over nice and easily. Again, because it's so common, there's so many good treatments and good options available that could address your symptoms, address those low T symptoms.
Awesome. So, kind of saying that there's a lot of good treatments out there, and you kind of touched on it a little bit, but what would be some ways that as a, healthcare professional, you're going to notice that, and maybe even some of our listeners, how would they notice that once they've started TRT, that they're actually getting a good response from it, other than maybe energy and being able to stay in the gym, libido? But is there anything else that might kind of show that they're really responding to medication well?
Yeah, I mean, really, it's you basically feel like you felt before, right? Before you were experiencing your low T symptoms. So a lot of them, it's like, they basically feel like, I guess if there's one thing that a lot of guys really appreciate or they really like is they'll wake up, they're like, wow, I feel like I was in a fog. I feel like I was in a brain fog for months, years, whatever it is. Like, I'm seeing the world a little clear. I'm thinking clear. I'm happier. I have better mood. I have better energy levels. It just they just felt like they were in a rut and now they're out of the rut. That's the main. I'd say that's the most common thing that people guys say after they start on testosterone replacement.
I have heard just from people that I know that they do get like a big, obviously a mood enhancement, but also like just cognitive function. They're able to think clearer at work.
Yeah.
I think that's probably in combination with the energy boost, but they're overall just, it seems like their lives are really enhanced. And I've heard similar things to what you just said. Is it really kind of feels like it's bringing me back to maybe younger ages and feeling a lot more youthful exuberance.
Yeah, testosterone is so important. I'm telling you, it's so important.
Yeah, I agree. And so a big question, we had about 5 or 6 of our viewers ask this, and I don't think we could have answered this for them, but does insurance cover this? Are there any ways to get that? taken care of, or at least a little bit of help? Because I do know these therapies can get expensive.
Yeah. So obviously it depends on what insurance you have. Different insurances have different stipulations and different criteria for low T. But if you're anywhere, if you basically need, in simple terms, the most common thing is you need 2 blood tests under 300 or 350, again, depending on the insurance. So if you have 2 blood tests that show your testosterone levels are, again, underneath 300 or 350, as well as symptoms, then your doctor should be able to prescribe testosterone replacement therapy, and the insurance should be able to cover it.
Awesome.
Okay, so going back to kind of some of the symptoms that patients were having, and then they were starting to feel better from that. Before you get prescribed it, so you have to have the blood test and things like that. Is that for every case, or is there like how like most healthcare has like guidelines you have to kind of follow like a systematic kind of process? Is there one for testosterone replacement therapy, or is it kind of more based on like what labs and symptoms reveal?
Yeah, the latter. So it's a little bit more. It's not as algorithmic, excuse me, as you think. There is some, there is the flexibility in terms of what your labs show and then the treatment options. So yeah, it's not very cut and dry.
And are there any other areas in medicine where this could benefit other than just general hormone replacement therapy? Is there anything?
Oh, for sure.
Could you just list a couple of those things for us, just off the top of your head?
Yeah, I mean, look, this is what I always say is, there's data, there's science supporting this, right? That shows if you compare, like, let's say, a 55-year-old guy with normal testosterone levels, with that same 55-year-old guy with low testosterone levels, the one with normal testosterone levels, he's decreased risk of having a heart attack, decreased risk of having a stroke, and more than likely he's going to live longer. His overall mortality, or his overall survival is going to be longer, right? Because testosterone is so. We need testosterone. We really need it. There's a lot of myths that came out in the 90s about testosterone causing prostate cancer, causing cardiovascular risks. Now, prostate cancer, we know that it doesn't cause prostate cancer by any means. Cardiovascular risk, there is an association with cardiovascular risk if your testosterone levels are super high. I'm talking in the thousands, right? But that's, as medical professionals, our goal is never get you to the thousands. Our level is to get you back to a normal eugonadal state, which is probably in the mid, the 500 to 700s for most guys. But yeah, I mean, you need it. You need testosterone. You will live a good, longer, healthier, happier life when you have normal testosterone levels compared to when you have low testosterone levels. There's no question about it.
So aside from the how you just mentioned the cardiovascular risks, what are some other problems that might occur if people are overusing testosterone, or if they're abusing it? Essentially, what could that cost for them?
Yeah, so like we talked about earlier, when you take too much testosterone, or one of the risks associated with testosterone, especially the injections, is you get erythrocytosis. Your red blood cell counts go up. So when you have too much of that, as you can imagine, your blood becomes thicker. Your increased risk of clotting. So basically, your heart's not going to get enough blood. Your brain could potentially stroke out. So you get heart attacks, strokes. That's if you have really, really high levels of red blood cells. But one thing we do to mitigate that is blood donation, basically phlebotomy, where you could donate blood or go to somewhere where they basically take some blood out of you, and by doing that they're able to reduce the concentration of the red blood cells in your bloodstream.
Wow. And so you just kind of triggered another question is, you're talking about a guy who's maybe in his 50s when he starts this, and he can live a lot longer. So at what point in time does somebody start this, and how old? I mean, is there an age limit to it? Is there any type of contraindication, if an 80-year-old is still on testosterone over a certain period of time?
Yeah, I mean, you obviously want to be in a good cardiovascular state. So if anyone who has had cardiovascular events anytime within the last 6 months, generally you try to avoid giving them testosterone replacement therapy. So if they had a heart attack within the last 6 months, you want to get cardiology clearance before you start them on it. And then the fertility one is huge. So if a young guy wants to start testosterone replacement therapy, there's nothing wrong with that, but you just have to understand the risk of losing your natural body's ability to produce sperm for a short period of time. About 6 months. I tell patients anywhere from 4 to 6 months. It is reversible, but it's going to take time.
So are there other options for the patients if they're not allowed to do the testosterone? Are there other options for therapy for them, or they kind of go to modalities to their symptoms?
No, the things I talked about earlier in terms of there's medications we could give that will naturally stimulate testosterone production, give you a boost. And if a young guy comes in, I'll try to avoid testosterone replacement therapy, because by putting him on these other medications, they could they could preserve your fertility, but also give you a natural boost in testosterone. And I mean, upwards of 95, 98% of the time, these guys they do wonderful. They do wonderful. They don't need testosterone replacement therapy. Rather, we give them these natural medication, or these options that naturally increase their levels.
Is the therapy effective for, say, patients who are missing a testicle or missing both of them? I would imagine not having both testicles will probably be kind of really dependent on how well you can handle testosterone in the first place, I suppose.
Well, if you don't have testicles, there goes the bulk of your testosterone production. If you're missing two testicles, if you have one testicle, there's a lot of guys who have normal fertility and testosterone values their whole lives with one testicle, because the other one compensates for it. If you don't have any testicles, yeah, you're going to be dependent on testosterone replacement therapy going forward. Yeah.
All right. And then, so something else that you mentioned a few seconds ago is you were saying that if a younger person comes in, that's my roommate, Josh. Hey, Josh, you're on the podcast.
Hey, Josh.
A younger guy comes in and they want to initiate testosterone replacement therapy, and you think that maybe it's not a good idea just because of their age. Is there any, I guess, more natural, holistic ways that they might be able to kind of come back to normal? Is like if they're very overweight or they drink a lot of alcohol, things like that. Do you suggest that they make some lifestyle changes in order to see where they could be just as a healthy 20-something or early 30-something-year-old?
Yeah, it's a great question. It's a great question. So they've done studies on this where they looked at medical residents, right? Like physician residents who are in the hospital. They compared their testosterone levels. And remember, medical residents, their sleep schedule is very poor. So, sleep deprived group of medical residents versus other hospital staff, and they compared their testosterone levels. And the medical residents were 200 points lower than the rest of the hospital staff. So that tells you poor sleep cycle could significantly reduce your testosterone levels. So generally, you always would say try to get 7 hours of sleep. The last 4 hours of sleep are when you're actually producing the most amount of testosterone. So sleep is huge. The second one is weight loss. So if you decrease your body fat percentage, or you decrease your weight by 10%, you get a roughly 120 point increase in your testosterone levels. If you decrease it by 15%, it's almost a 200 point increase in your testosterone levels. So weight is definitely weight, and so diet. I mean, when I think of weight, I say diet and exercise. If you get a good diet and good exercise, they'll help decrease your weight, and then getting good sleep, at least 7 hours a night. And obviously, vitamin D, zinc, these are the things. Good cholesterol. I mean, decent cholesterol levels. These are all things that go into producing normal testosterone. So you need those as well.
Very cool. Well, it's been really great talking to you. I think that was really comprehensive, quick and dirty on TRT. So Dr. Houman, it was a real pleasure, and we'll have to do it again sometime.
Yeah, I'd be happy to.
Interested in the male fertility stuff. I think that's pretty.
Yeah, definitely.
So we'll have to do it again, and we'll get this posted up real soon.
Cool. Thank you. Thanks for the time, guys.
Thank you.
Thank you.
Your time.
Have a good one.
You too.